Hi, I'm Dr. Raj Sundar, a family physician and a community organizer. You're listening to Healthcare for Humans, the show dedicated to educating you on how to care for culturally diverse communities so you can be a better healer. This is about everything that you wish you knew to really care for the person in front of you, not just a body system. Let's learn together. Metal cafeteria trays, rows of rectangular tables, and seniors filling in, picking up food, eating alone or in small clusters, sorted by language, and then leaving. That was dinner at South Park Senior Citizens before the pandemic. Very functional, very institutional, and siloed. Cambodian seniors on Mondays, Vietnamese on Fridays, and Hispanic seniors on Wednesdays. Now, walk into that same building on a Friday night. You'll see round tables draped in linen, china, and silverware, a chef who carves radish flowers and shapes them into cherry tomatoes into little animals for the salad, of course. Vietnamese karaoke and line dancing after dinner. And around those tables, a man turns to the executive director, who you'll hear today, points to every person seated with him and says, "We are all from different countries, and now we are all friends." Those are two different versions and two different visions of what it means to be a senior center and address food insecurity. We've talked about food as medicine in this podcast before, and it is one of the most important things in healthcare. And we know healthcare over the past decade has started to acknowledge it, start to screen for it, and now building relationships with community-based organizations to address it. South Park Senior Citizens is an organization that I feel close to because I was a board member just recently. And obviously, that makes me biased. But even with that bias, it is an organization so unique and doing such important work that I feel like it's highlighting and thinking about what it means for other organizations addressing food insecurity in their communities. Today, Catherine Jordan, the Executive Director of South Park Senior Citizens, walks us through what culturally responsive care looks like when it's built from the ground up. You'll hear how South Park Senior Citizens redesign their entire dining experience from cafeteria to a community table. Everything that I just told you. And how their culture-focused program spent 7 months immersing seniors in each other's traditions through food, dance, music, language, and field trips. It sounds fun. So not only are we talking about food here, we're talking about social isolation, community building, cross-cultural care. So yes, this podcast episode is about food as medicine. But when I say that, usually that means what's on the plate, the nutrition label, the cultural connection to home. But South Park Senior Citizen pushes that idea further. Here, food as medicine means how you eat, slowly, in community, at a beautifully set table where someone knows your name and your dietary needs, and have also arranged your ride home. Former Surgeon General Vivek Murthy wrote an entire book about social isolation as a public health crisis, equivalent to obesity and smoking in its physical toll. For immigrant seniors carrying decades of accumulated trauma from displacement, war, xenophobia, and systems that were never built to understand them, that isolation compounds everything. The natural aging process gets harder, the emotional weight gets heavier, and the healthcare system, with all its online portals, its language barriers, and its blind spots, often feels like one more place where you're not seen. We use the word seniors, but in so many cultures, we call them elders, with respect and dignity. What South Park Senior Citizen demonstrates is that culturally responsive care doesn't require a massive budget or system-wide overhaul. It requires intentionality. Here's Catherine to talk more about the vision and the mission of the organization. Welcome, Catherine. How are you doing today?
I am doing great. Excited to be here with you.
Tell me a little bit about yourself and the organization that you work for.
I am the executive director at South Park Senior Citizens. We're a tiny org down in South Park, South Seattle, and I have spent my career leading in organizations, human services focused, really focused on serving folks who are living very vulnerable lives. And I have been with the organization. I started right as the pandemic kicked off And so it's been very interesting last 5 years that we've moved through. But I'm really honored to be doing the work that I'm able to do, serving our seniors every day. The organization has been in South Park. It actually started in 1974, very grassroots, with just some neighbors saying, hey, let's go hang out at that community center down at the end of the block and bring some cards and bring some lunch meat, and I'll bring the bread and we'll make sandwiches and hang out. So it was very informal, and it slowly grew over the years. We're in a tiny little community center called the South Park Neighborhood Center. We share the space with 3 other organizations. Definitely a nice, tight little fit in that little building. But over the years, as the organization has grown, just more and more folks have found us. And really, at the time of the pandemic, when so many little orgs, it was a scenario of you either evolve to meet the current demand or you close down. And we were fortunately able to evolve and made it through that rough time and have significantly grown, tripled our budget and tripled our staff and tripled our impact since that time.
Yeah, it's incredible to think of how small organization in a period like that. And obviously you took over the organization right in the middle of it, essentially, in the middle of the transformation.
Yes.
And it's an incredible way that you pivoted during that time. I wondering what it looked like in 2019 to what it looks like now in the services you provide and how you provide it.
Again, I wasn't there in 2019, but from everything that I can piece together, it was a very busy resource hub. I think things might have been considered a bit more transactional as far as people coming in, getting resources and leaving. And there was a food program at that time. It was a bit more institutional in a way. It was cafeteria style. Folks had metal cafeteria trays and set in rows in long rectangular tables in rows. And it was just an in and out. There was some community being built there within different cohort, different immigrant groups that were coming to the center. But things were very siloed. We provide services at the center Monday, Wednesday, and Friday. And we had Cambodian seniors only on Monday nights and Vietnamese seniors only on Friday nights and Hispanic seniors on Wednesday nights. And folks did not mix. They did not integrate at all. As I arrived at the center, when I arrived at the center during the pandemic, of course, the building is locked down and no more folks are coming to the building. And so we did spend that time, those 2 years, preparing and delivering 600 meals a week to seniors in their homes. And during that time, the word spread to where we ended up serving 57 different zip codes in the King County area. So lots of folks found out about us during that time. And also the county and the city really started to rely on us as standing in this first responder food access space during that time. But as we prepared to come back after the pandemic, I had established an amazing team that was there doing this preparation for reopening with me. And we had a vision for having it be more of a cultural hub, more of a place for people to come and engage and to build friendship and relationships and learn and grow, and really highlighting our diversity as a place of celebration versus something to divide us. And so that really became our focus. And we had 2 great scenarios that were happening as we reopened. The first was we knew that the center was really anchored in a meal program. And our new operations manager, he was a former executive chef. And we talked a lot about what not just a meal program could look like, but what a dining experience could look like. And so we spent a lot of time building out a dining experience for our seniors. So as they were coming back after the pandemic, they were finding, instead of the rows of rectangle tables, they're finding round tables with linen tablecloths and china and silverware, and really wanting to execute a lovely evening, a lovely experience. And so that was really an important thing. And then to be in lockstep with that and to really try to address the divide between the different cohort groups that was there before the pandemic, we launched a program called Culture Focus that was right as we were reopening that first year. We dedicated 7 months over that year to really explore culture. And so we spent 7 months. Each month was dedicated to a different culture. And we spent the entire month immersed in that culture. And so it was the three primary cultures we serve: Vietnamese, Cambodian, and Hispanic, people from Hispanic countries, Latin American countries. Those were the primary, but then we also built out additional opportunities for learning about different cultures. And we also brought in the LGBTQ community as a culture to learn about and explore. And so we did that, and each month, every meal was from that culture. We did history. We learned about the countries. We learned about dance and music and expression. We learned how to say phrases in that language. We went on field trips that highlighted learning about that culture. And by the end of the year, there was just this ease in the space of people coming together. And it was so beautiful. And they asked that it continue. They asked that we continue to have this highlight of diversity and celebrating culture. And we've continued to do that. And it just has really made it, our goal is to have a safe, warm, inviting space. And I think it's been well achieved.
That was beautiful. For a small organization, I constantly surprised of how powerful the impact is. A few things this made me think of. Obviously, I've been involved in the organization in the recent past, but I think of the idea of what does food mean? When people think about food is medicine, they think about what the food is. And I think there's power in that of what is a nutrition label, what culture it comes from. And you noted how the diversity of cultures actually makes the food more diverse and maybe interesting and connects us to home. But the point that's really interesting with the organization is how you also think about it, not just what the food is, but how you eat it, which is in community with each other, slowly, mindfully, if that eating experience is really important. And that's how food is, right, for all of us, in that it's a way to build community. And the flip side of, especially during COVID, how much social isolation became an important aspect of people's health in a negative way. There's been so many studies now, but also our previous Surgeon General, Vivek Murthy, wrote a whole book and was passionate about how social isolation is one of the biggest risk factors for death even and suffering. So thinking of how can you use food as medicine and an expansive way of connecting with each other. And I love that. The second is this way to bridge communities. And it just sounds fun to learn about other cultures. I think in our current times where it often feels like there's some polarization and othering and otherness of coming together in people's culture, and a really powerful moment of, hey, we want to keep doing this. This is awesome. We love learning about each other and bridging people, communities, and really building communities across culture. And then lastly, there's power in the depth of relationships you can build. Because it's small, which is hard when it feels like we're a big food bank where hundreds and hundreds of people come through and no one knows you or remembers you. I think it's possible to do both, but at a smaller scale, you're able to do that well.
Thank you. Thank you. I had a wonderful experience the first year that we were there, towards the end of that first year, where I had a gentleman say to me, "Catherine, come here, come here." And I came over to the table and he said, "Look at everyone around this table." He said, "We are all from different countries." And he said, "And now we are all friends." And I just thought, there we go. That's why we're here. That's what this is for. And to your point, the truly impactful results of loneliness and isolation, our seniors definitely experienced such a magnitude of that during the pandemic. And AARP states, we reflect on this statement often, that it is equivalent to obesity and smoking as far as impacts to the physical health when you're managing loneliness, that emotion, loneliness and isolation. And so it's a wonderful place to be where we know that we are something that our seniors are looking forward to all day. And we're something on the calendar. We're a reason to get up and get showered and get dressed and get out the door. And people are going to be there waiting for them. And they know that they're coming. We make reservations every night for all of our seniors. We do it for a couple of reasons. One, because we are small, we can only seat 54 people. So we don't want to have to turn someone away if we're at capacity. But then also we can accommodate for their diet preferences, food allergies, if we know who is coming. And lastly, we are able, for folks who have no other means of transportation, we are able to arrange transportation for them. And our social services team does that. Our team speaks all the languages of our seniors. And so they're able to contact Lyft, arrange for the ride, contact the senior and say, you can look for a white car with this license plate. They'll be coming at this time. And so the language isn't even needed because they know which car and they hop in and we're waiting for them when they arrive. And I think that's important for people to know. They walk into our center and their name tag is waiting. We're expecting you. It's important that you're here and you're our guest tonight and we're excited to have you. So I love being at the front door and greeting people when they come in. It's one of my favorite parts of my day is just being at the front door to greet them as they come in. It's like a big family. It really is.
Yeah, I love it. Imagine you're serving the Khmer chili chicken as cuisine and hosting Vietnamese karaoke nights. Can you paint us a picture of what someone walking into SPSC on a typical evening would experience?
As I just mentioned, we will make that reservation and we will get them there and we will know that they are coming and we'll be expecting them. And they'll arrive, we'll greet them, get their name tag, and then they'll go into the dining room and take a seat. We have a lovely table set for them. And as they come in, our staff and volunteers, we're very fortunate to have volunteers each evening helping with our dining service. They're approaching and offering a beverage, and they're able to enjoy that and sit and wait while their fellow seniors arrive. And then we serve a salad course each evening. Once that is cleared, we bring out our dinner course. And each evening, our meal is from different countries all over the world. They are from our seniors' own countries, but then we're also out exploring other cuisines from around the world. And that's something that they have shared with us. We don't have an opportunity to do this in any other way at any other time. We don't have the money to be able to go out to eat out. The seniors we serve are really living very low income. And if we did have the money, we probably wouldn't choose to go and explore this cuisine. And that's a fun aspect of it, the learning and exploration and curiosity part of it. At the end of dinner, we have announcements every evening. They're interpreted for the languages of the seniors who are in the room with us. We always introduce and welcome new seniors who have joined us that night. And then we just share information about any activities that are coming up or resources that we have access to, can share with them so that they're always aware of what is happening in our center community. And then after that, we flip the room because we're so tiny. We have to put away the dining room, if you will, and clear the floor so that we can move into our evening activity. And each evening is a little different. Monday night, we do cultural dancing, and it's a very simplified dance, so anyone can join in very easily. And Wednesday night, we shake it up quite a bit on Wednesday nights. We rotate through Zumba night to arts and crafts to movie night to bingo and loteria. We have our book club that meets on Wednesday nights as well. And that's always moving and shaking there. A lot of fun difference. And then Friday nights is always karaoke and line dancing. It's a bit of the club environment, the place to be on a Friday night.
That's awesome. Who organizes the programming?
We have a program manager, and they work very closely with our operations manager. And so it really is a big team effort because we're also closely working with our social services department because they're the ones that are contacting the seniors for reservations. And so we know who is coming. So we're maybe able to meet certain accommodations or needs that might be needed for each evening. But we have our programs manager and the party on the dining side of the house. And then our operations manager is really overseeing the kitchen and the meals that are rolling out. And it really is a big team effort, everyone coming together.
I just love how I'm just imagining Mondays, Wednesdays, and Friday. It just sounds fun. Is that sometimes I feel like the idea of food insecurity is like where we don't want anybody to be hungry, but actually the process of community can be fun. I think you captured that with some of the programming and how the staff is able to create a real Friday night for the community dancing.
I witness that every evening when I'm there. I recognize that nutritious meal is doing so much good for the physical body. But what I witnessed is joy and levity and excitement, kind of giddiness. And it's so wonderful to see that in our seniors, just to see them happy, just to see them excited. And they take that feeling home with them. It goes home with them. And I think there's just a lot of healing and a lot of just health and resilience in that space.
Yeah. I think a part of the reason I want to do this episode is to share what happens here. I feel like we've captured a little bit of the story and what a night looks like, because it took me a while to figure out the power of it, and you just captured it so well of what happens there. I think it's important for people to hear is about the staff themselves. Specifically, the chef and the kitchen staff often reflect the ethnicities you serve, and really thinking about providing food aid in a fine dine setting. How does that affect the food choices, where you get the food from, and how the meals are created? I would love to hear the creative process that happens and of how you decide on the food.
We have had so much evolution in this department, in this area over the last 2 and 3 years. We have established so many really strong relationships with local farmers. And we get the majority of our produce is coming from local farms. And so we're looking at this farm to table experience where some of the produce that comes in, it's very exotic to the point we will go maybe a topping on a salad. What is this? I've never seen this before. And we'll work our way around the dining room explaining what this is. And so it's wonderful to have kind of that farm to table experience. And I'll share very briefly, I just had this wonderful experience where I heard through the grapevine of a farmer who was having produce picked up from him out in his field, picking up produce. And he had said to the person picking it up, I wish I knew where this was going. This is our family's, this is what we do. And we planted these seeds, and I wish I knew where this was going. And this gentleman happened to be a participant at our center. And he took out his phone and he said, let me show you where it goes. Because our seniors take pictures of their dinners. They're beautifully plated. They're a beautiful presentation. And he said, this is where your produce has gone. And that was such a big impact even for the farmer who is providing the resources that are coming our way. So we do use that resource as much as possible. Everything that we are using for our meals is fresh. We try to be organic whenever possible. Nothing's coming out of a can or a jar. And we do purchase food, but then we also have an amazing partnership with Food Lifeline. We receive contributions of food from them. And then also we're a part of the Meals Partnership Coalition. And through the coalition, we're able to secure food resources as well. And the creative process really comes with our 2 co-chefs, Chef Tam and Chef Tony, and they work with our operations manager, Corey, and they sit together. We plan our menus 2 months in advance. And so they sit and they brainstorm, they reflect on meals from the past. We've created an electronic cookbook, so we're able to track meals we've done in the past because we know some of the tried and true favorites of our seniors. I think banh mi is definitely one of them. But so we'll reflect on that. And then also, they do spend the month coming up with new ideas and new recipes that they want to try. And so we're planning 2 months in advance. We do align it with upcoming cultural events we're going to be celebrating at the center and aligning specialty cultural meals for those events. And then we also have the menu reviewed by a nutritionist to be certain that what we're preparing is aligning with the needs of seniors. So that is the process. And so that's where it starts. And each evening, there's the opportunity to something that we really pride ourselves in is the plating of a meal, the presentation of the meal. And that has really become the art form in the kitchen. And Corey has meticulously trained our chefs on this art of presentation. And they do a beautiful job. And Chef Tam is an artist with a knife. She will carve and make beautiful things out of vegetables and fruit. And your salad comes to the table with a beautiful flower made out of a radish or cute little bunnies made out of cherry tomatoes. There's a lot of just labors of love that go into preparing and plating the meals. And I think that's just really out of honoring and respecting our seniors, just giving a little extra love that way.
I love the intentionality behind all of that, from the carving of the vegetables and the fruits. And we originally started this part of the podcast with the farm to table experience. All this language feels like we're talking about a Michelin star restaurant in New York. And that's what I love about it, how the terminology can be accessible for people in our communities. You don't have to feel like you can't afford this experience. And I love, you're just a great communicator in this. We bring in some conversation and stories about somebody showing pictures to the farmer. And I think it speaks to that idea of people's connection to food. And we discount the farmer's connection to the food they grow because our system's so industrialized. It's like, it's just going getting shipped somewhere. But farmers knowing actually which table it's going to and who's cooking the food, I'm sure is really powerful to them too. So
I was very touched by that story. And I was raised in farm community, raised on an apple ranch. And so I understand that idea of so much love and work going into raising. But then once you put it in that box and ship it off, you don't know what that impact and that end result will be. So I was very touched to hear that story. It really resonated.
Me too. We talked about food, we talked about social isolation, but I know you actually have social service specialists that can speak multiple languages, and they're helping people in so many different ways. Do you have stories on how they're able to do that, or because of both their background and language, and what kind of services are you providing?
Our team, they do speak the languages of our seniors, but they are all also immigrants themselves. And so I think the best connection is that our seniors know that there is this shared lived experience with the social services folks who are there to help them. And so I think that immediately allows them to feel less guarded and more seen and more understood. And that's really a strong starting point to build these really relationships of trust that allows seniors to get the most out of the support that our social services team can provide. We often see that people come with a solitary, simple need. It's like, I need a meal for tomorrow night, finite. But then as they start to have conversation, our social services team is really excellent at listening for what is not being said and just adding more and more to the conversation. And pretty soon they are able to share really the depth and the magnitude of what their need is. And our services can range anywhere from ensuring that housing is stable, housing is safe. Are they safe in their home? Are they getting the medical care that they need? a lot of medical care is such a challenge because one, there's so much technology involved in even getting an appointment, doing an appointment. You have to be online and fill out forms online. And our seniors really are not comfortable in the space working on technology. There's the language barrier, the cultural barrier, the systems that are so large and looming. When our social services team works with someone to secure housing, that can take months and months of time. And there's a lot of government infrastructure they have to move through there, a lot of understanding of support programs. They might get declined and have to reapply. And when our team can be there to just walk alongside them and consistently see them through to that next step, I think that's where the win is. And that allows them to really lean into all that we can provide. We've been very fortunate to launch a medical access program over the last 2 years, and it essentially allows us to create care plans for seniors who really have significant medical care needs. Creating that care plan, working with the physician, connecting into resources they might need like walkers or canes, glasses, hearing aids, just really doing the whole person wellness perspective. And I think not having that language barrier and not having that cultural barrier just really allows them, I think, to jump right in to the work and really be able to make the most progress. And I think a couple of other things that we see often, we do not provide legal advice, but we support them as they're navigating a legal process. We might go with them if they're needing to go to court, that type of thing. Transportation is a big need within the senior community. One, with our seniors being as low income as they are, they can't afford to maintain a vehicle. Some of them are due to mobility concerns, I should say, not able to use public transportation. And so that leads to their isolation. And we're fortunate to be able to provide transportation, limited. It really is meant for folks who just truly have no other means, but be able to getting them to medical appointments, to food resources, and ensuring that they're connecting in those ways.
Yeah, thanks for sharing that. A lot of resources and built with this word keeps coming back to me of intentionality. I do feel like it's become somewhat of an industry of caring for seniors. If you could say one thing to, let's say, healthcare administrators who understand the need for serving older refugee families, but say, we don't have the resources for this, does it really need to be this time intensive and people intensive to help our seniors? What would you say to them?
I think my first response, the first thing I think about is the significance of the lived lives of these immigrant seniors and the pain body, the accumulated emotional pain that they carry in their body, have carried for decades in their body due to the trauma that they have experienced as they have fled their countries due to war and violence, or even simply immigrating to the U.S. of their choosing, but recognizing that also comes with an isolation and a loss of home, a loss of familiarity, a loss of family and friends and everything that you've known. And so I think that really taking into account that there is maybe this physical body being presented that is coming in for a healthcare medical appointment, but really understanding from my perspective, as the body ages, there's the natural aging process and all of the challenges that come with that. But then for seniors who have lived these life experiences, the addition of all of that emotional trauma, it just magnifies the impacts of the aging process and makes it just that much more acute. And so I think that would be a perspective that I would invite healthcare providers, administrators to think about as a part of the equation, what we're not seeing and what they're not able to share. And I think that people, all of us, we just want to be seen, we want to be heard, and we want to be valued. And I can say for the seniors that we serve, the countries of their origin they come from a country where their elders are honored. There's a reverence for them in their home country. And in the US, that really isn't present in the same way. And these folks they've lived lives in the US experiencing racism and xenophobia, and they're not understood due to language barriers, and their customs and their traditions for medical care are also not part of the equation of discussion. And so it's a very foreign space, that very vulnerable and foreign space. They come into a medical environment seeking care that they know they desperately need, that maybe they've put off for way too long. And I think there's just a true additional sense of vulnerability that they are experiencing. And I do recognize that if you are wanting to provide culturally responsive care and have it on a large scale, like somehow completely flip all of your way of doing business so that there can be this culturally responsive lens that all work is being done through, that is huge. That is a huge shift. And resources are slim. But what I encourage is just the thought that having one person in your office environment, your doctor's office environment, one person who looks like the primary demographic that comes in your door, speaks the language of your primary demographic, just having that one person allows a sense of familiarity and security that I think just that could really lend to progress in what can be made. I could not do any of the work that is happening at our center without our team. It would be impossible, but for me, it would be completely inauthentic. I am a white woman running this organization, and I think of that every single day. And it is truly the team that has the lived experience that allows us to be authentic and to do it well, to hit the mark.
It was beautiful. Well said, Catherine. Thank you for sharing that.
Absolutely.
For listeners who are moved by this conversation, what's one thing they could do tomorrow to support culturally responsive care in their own communities?
I just encourage folks to connect to organizations in their community that are serving people of color, that are serving immigrants and refugees, and just find out what they do. What does the organization provide as far as support? And what possibly could they do themselves to engage, even if it's being curious and leaning in. But you can donate monetarily, you can volunteer, you can bring your time and your talent to further the reach and the results of these organizations. And I think right now, just with the food crisis that we are all experiencing, connecting into the local food banks is a powerful place to be. And one thing I really encourage is for folks to recognize the people who are in need of the food resources and then also the food that is being provided, and recognizing, does that connect to their culture? Receiving this food, is this meaningful? Because I think, again, going back to what our programming is based on and how your identity can be anchored in that food and just simply the joy of it. And so I encourage folks to connect into their community and just having that awareness of how powerful food can be in building community and ensuring the health and vibrancy of everyone around us.
Love it. That's a good transition on where can we find the center and how can people get connected and what does support look?
Our address down in South Park is 8201 10th Avenue South, Seattle 98108. We are in the South Park Neighborhood Center. And folks are very welcome to connect with me, Catherine, KATHERINE, at spseniors.org. Very happy to connect with you all. And anyone 55 and older, that's my disclaimer. Anyone 55 and older, very welcome to join us for dinner any evening, Monday, Wednesday, and Friday. Everything we provide at the center is free of charge. And so we have fitness class every Monday, Wednesday, and Friday from 3 to 4. You're welcome to join for that. and then dining, and then our fun after activities. And of course, our ongoing social services support and engaging in our cultural events are a really fun space for experiencing other cultures.
Thank you so much, Catherine. This has been really fun.
Yeah, thank you, Raj. I appreciate it.
As always, thank you for listening to Healthcare for Humans. If you've found any value in this podcast, I have 2 quick requests. 1, please leave a review in the podcast app that you're listening to my voice in right now. It really helps others discover the show. 2, share this episode with anyone who you think might benefit from it. For easy access to all our episodes and to support the podcast, visit www.healthcareforhumans.org. There you'll find our content clearly organized by topics, countries, themes, to help you choose what to listen to next. Until next time, this is Dr. Raj Sundar, reminding you that culturally responsive care leads to better patient outcomes. See you again soon.